Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. The route is determined by the provider, by your cancer team. They're going to be determining which route is best for that particular individual. Okay. So I want to go over each of the main routes. If you're getting cancer treatments, it's being given to you in that route, then it's helpful to make a note of that and get a little familiar with it, know what to expect and why that route is being chosen. So you can feel much more confident about the treatment you're getting and you know what to do about it. Okay, so let's first touch on oral chemotherapy. It's kind of self-explanatory. Typically, chemotherapy is given IV, but now we are starting to see more and more oral chemotherapy. Oral chemotherapy means you'll be given tablet, the way you take Tylenol or other medications, same way you're getting chemotherapy tablet that you take at home. So that means you don't have to do blood draws, you don't have to go for the appointment to the hospital. The challenge here is, it's important to know what to take and when to take it, because you have to still follow the protocol. It's important to stay on track with these medications. Very, very important. And secondly, unfortunately, the cost of oral chemotherapy right now is quite high. So there can be a cost impact on this. We have another presentation and information resources on what are the different financial resources you can use. So you can always refer to that. The other one is next one, which is most common, is IV chemotherapy, which is the infusion. You might have seen pictures like this, or going for your own infusion, or seen for your friend. So in this case, what we do is we essentially are diluting the medication into a liquid, so either saline or glucose, and it's given into your bloodstream. Okay, and for this, you typically come to the infusion center. So I used to give a lot of chemotherapy. I worked at an infusion center, so I gave a lot of these chemotherapy treatments. So I think the benefit is that, we are able to give you flexible dosage and the treatment is happening at site. So we're able to make sure that you have received the full treatment. Of course, the disadvantage here is that you need to go to the infusion center to get your treatment. And if you're getting treatment for a very long period of time on IV, then there can be some scarring and vein damage, which is also why you might be given a catheter, which kind of stays under the skin once it's inserted, or you might be given a port, so that once the port is placed on your body and the port is inserted, then next time this silicone tip that you see, we are infusing through the port, and we don't have to constantly keep poking your veins and giving you chemotherapy through the vein. Okay? So that's why port is very helpful. Typically, when port is inserted, we will put a local anesthetic there so that you don't feel the pain. And then the port is inserted, and when you go for your chemo treatment, then we will access through the port and give you chemo through the port. Okay. Yes, it can be sometimes, visible and feel uncomfortable. If you're having pain from your port for more than a day or two, then do get it checked out by your provider to see that everything's okay. Generally, after some time, there isn't pain. And the benefit, of course, is that the medication can be delivered through the port, and also it reduces the risk of skin irritation and infection. Now, the other thing you might have seen is a pump chemotherapy, where we send you home with a pump. So you could be getting continuous infusion. So earlier we used to have where we would keep you in the hospital for that whole time, where we would be giving you treatment. But now with the pump, it is automatically delivering the medication to you at a certain speed for that period of time. So like 5-FU or those kind of medications, you could be getting it into your bloodstream at a steady rate. And these infusions can last, 24 to 48 hours. And once it's done, then it stops. And this way, you can go home and you can be in your comfortable home setting, even when you're receiving continuous therapy. And you don't have to keep getting, usually we'll put a port or we will put something so you don't have to keep getting poked with a needle the whole amount of time. The disadvantage, of course, from this is that you have to learn how to use the pump, and sometimes it feels a little bit uncomfortable having a pump on you, kind of like like a little thing you're carrying on your body. But the advantages are quite significant. For most people, they prefer being at home with the pump than being in the hospital. So that's pump. Injection is when we give you an injection. It's like a shot, like the way you sometimes get those shots. So those are deep shots that we would give into your buttocks or your arm or your stomach or leg. So you come to the center and we give you the shot. So it's delivered fast, it's delivered to a target area, and it's done. So it's a quick way of being able to give you the treatment. There's a very slight risk that there could be nerve damage around the injection site. Most clinicians are well trained in giving the injection, so those situations are quite rare. It can be a little bit sore or painful at the site for some time, so that's where you might want to take care of that soreness on the site if you've got an injection. Intrathecal is when we are giving you the chemotherapy into your spinal cord. So it's given through a catheter into the spinal cord, because that's where we think it's going to be most effective, because normal chemotherapy is not crossing the blood-brain barrier. So if we want the chemo to reach your spinal fluid and reach your brain, then that's where we are using intrathecal chemotherapy. It can be painful and a little bit uncomfortable. There is risk of infection, which, important to manage. With some care, that risk can be managed. Because we are accessing the fluid, some people do experience some headache. But overall, it allows us to be able to treat those brain and spinal cord cancers, which are hard to reach. And that's why intrathecal chemotherapy is given. Intraperitoneal chemotherapy is when it is given in the peritoneum. Peritoneum is in your abdominal area. So when chemotherapy is given in that area, then it is called intraperitoneal chemotherapy. So it's for treating cancers that are in the abdomen. Now, it's quite beneficial because it's targeting that local area instead of the whole body. And higher dose and targeted dose can be given, and it does not affect your veins because it's directly being given into that particular. From a disadvantage standpoint, it can feel a little bit uncomfortable, like it's bloated or some pressure in the abdominal area when the treatment is going on. Usually after some time, then that goes away. This one is less common, intra-arterial chemotherapy. This is when we want to give chemotherapy that is given into the artery, because we are addressing cancers that need to be reached through your artery. So these are typically for head and neck kind of cancers or other cancers which are difficult to reach. When it is arterial, then typically we want you to stay in the hospital because we want to monitor you much more carefully to make sure everything is okay. But by doing this, we are essentially trying to protect all other organs of your body and at the same time reach the place where your cancer is. Now, topical chemotherapy means that it is chemotherapy that's on the skin, topical, right? So it's typically like cream or gel or ointment, something that you're putting on your skin that is for addressing that cancer. What's important to know here is that You want to store it properly. So with the right temperature, if it's saying cool, then make sure it is kept in cool area. If there are certain guidelines about how it is to be used, and with gloves or with applying only to certain area or certain amount, so you want to keep a note of that and use those, and then dispose it properly. Also, keep away all of these different treatments. If you have at home, then keep away from children and any unauthorized usage. Also know when and how often you're supposed to be using these treatments, so that you know what to do and how you can have the best outcomes. So with that, let me take a pause here and to check how you're doing. What is the route that you're getting for your treatment, and any question related to the route, to the chemotherapy route. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell, so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.